Hello, everyone, and welcome to Cellular Healing TV. I'm your host, Meredith Dykstra, and this is episode number 180. We have our resident cellular healing specialist, Dr. Dan Pompa, on the line, and I do not see your typical Utah background because you're not in Utah. You're in Florida with our guest expert, Dr. Mike Van Thielen, and we have a super exciting topic for you guys today, one we've never really delved into on Cell TV before, and we're going to take a deep dive into stem cells and stem cell therapy. So before we dig in with Dr. Mike, who's an expert on the subject, let me tell you a little bit about him. Dr. Mike Van Thielen, PhD, holistic nutrition and wellness stem cell expert, author, and keynote motivational speaker, has been involved in optimal health practices, anti-aging, and regenerative medicine, sports performance, nutrition, and supplementation, that's a lot, for nearly 3 decades. Dr. Mike is a licensed physical therapist, a licensed acupuncture physician, and a doctor of Oriental medicine with certifications in injection therapy, homeopathy, and homotoxicology, Chinese herbal medicine, and non-invasive cosmetic procedures. He also has a PhD in holistic nutrition from the College of Natural Health. In 2008, he founded a company that certified healthcare professionals in health and wellness programs, sensible weight loss, and natural non-invasive cosmetic procedures, and trained over 1,000 professionals in just a few years. Dr. Mike sold the business in 2014 and has since dedicated himself to bioregenerative medicine applications and stem cell therapy, and is the president and CEO of NeoMatrix Medical, where you guys are today at the clinic reporting live, and we're going to dig into stem cells. So very excited to learn, and welcome Dr. Mike to Cell TV.
Glad to be here.
Yeah, I'm glad to be here too. You know, the last year I've dedicated to learning more about stem cells. That's why we've never had a show. I'm just digging into this whole thing. And, you know me, Meredith, I remain skeptical, and I have a lot of questions. Mike and I have been doing a lot of homework over the last year, and, even more so with your product in the last few months, knowing I was coming here, and I really wanted to, do my homework. But a lot of our viewers and listeners, they probably don't even know what we're talking about stem cells. They've heard the word, but they really don't know what it is. Start there.
Yeah, there's a lot of confusion, not only with the listeners and the prospective patients, but even amongst the providers and the healthcare professionals. But a stem cell basically is a very unique cell, and it separates itself from any other type of cell in the body by having 2 cardinal properties. Number 1, a stem cell can self-replicate. In other words, it can make an exact copy of itself. And number 2, it can replicate or duplicate or differentiate is actually the best word, differentiate into any other specialized cell type. What that means is, for example, the analogy I like to use is that of a joker in the deck of cards, right? When we have a joker in the deck of cards, we can make it become an ace of spades or the 10 of hearts. As such, a stem cell can become a brain cell, a blood cell, a bone cell, a cartilage, a liver cell, muscle, tendon, ligament, etc. So it's those 2 properties that make a stem cell unique and gives it the, endless possibilities in the medical community.
All right. So, when we think of stem cells, there's a lot, at least there was a lot of controversy around stem cells because it was embryonic.
Correct.
Right. So, explain that to the people that things have changed.
Yes, stem cells come from different sources, and even our politicians, when they were running for the presidential debates and stuff, they don't understand because they dismiss the enormous potential of stem cells in the field of medicine because they wrongly assume that stem cells come from aborted fetal tissue, right, or from embryonic tissue. And of course, there's a moral and ethical dilemma there, but it has been proven that when you use embryonic tissue, for example, in mice, that it causes carcinomas, which is cancer or tumors. So embryonic tissues will never be used in the application for humans. So the point is actually mute to talk about ethical, moral issues or embryonic stem cells because they're not used. But that's what people still think, that those stem cells only come from those, fetal tissues.
Yeah. All right. So, tell our listeners and viewers, where does it come from? What's changed?
So we got the embryonic tissue, we have placental tissue, and we have umbilical cord tissue. So those are all human tissues. And then we got also stem cells that are derived from the patient themselves. We call it autologous tissues, coming from the patient. So they derive it either from the adipose tissue, the fat, or the bone marrow. Those are the two common places where you can derive stem cells from.
In my research there, I mean, the bone marrow, some people have had success, but it's a little more invasive. The fat is less invasive, but it seems not to work as well, at least out of those two. So tell us, like, what is the success between those two? Because that's still very popular. A lot of people are still
Most providers are doing that.
Yeah, exactly. Right.
So in order to explain that very well, I'd like to, if you don't mind, is explain what the ideal source would be of stem cells in order to effectively and consistently regenerate and rebuild damaged connective tissue. So the ideal source would have 4 essential components that basically work in synergy in order to get those results, right? I like analogy, so I'm going to use the one of a roofer. I just did that with H. The analogy of a roofer. We're in Florida, we get hurricanes, right? So when a hurricane comes through, we all gotta, call the roofers. But if you have a leak in your roof, we gotta call that roofer. That roofer that shows up can be licensed, experienced. He can be the best roofer in the area. But if that roofer does not bring his tools, are we gonna get any good result? No. So the roofer needs its tools, right? Number 1. Number 2, the roofer also needs to have a blueprint or a structural engineering plan. He needs to take measurements. He needs to figure out what materials were used on the roof, etc. Okay? And then it probably needs a supervisor, somebody that tells them where to do, what to do it. Or it's basically you calling the roofer and say, hey, you got to come do this address, and this is the problem. So we got to get that roofer to the damaged area. So when it comes to stem cells, we have that similar thing going on. We need 4 components. We need the stem cells, high quantity and quality. Why? Because the stem cells is your workforce. Your stem cells are able to fix a damaged connective tissue, whether it's cartilage or a rotator cuff tendon, right? But it needs its tools. In the body, those tools are called biomolecules. For example, if I have a rotator cuff tear, I need collagens type 3, type 4, specific proteins, etc. It's the brick and mortar that we need to fix something. And in the body, those are biomolecules, okay? That's the second component. The third component is what we call collagen scaffold. It's your structural engineering plan, your blueprint. And in the body, we need that base or that structural base to build upon. So that's your collagen scaffold. And then the last component is what we call growth factors. Growth factors is me calling the roofer and say, hey, you gotta come to this place, you gotta wake up, you gotta get out of your bed, you gotta bring your tools, and you gotta fix this. So that's your supervisor, or that's whomever activates the dormant stem cells. So if we have all those 4 components available at the site of injury, we're gonna get great results and consistent results. But there's only 2 human tissues that contain all 4 essential components in high quantity and quality. It's placental tissue and umbilical cord tissue.
Got it. Yeah, so in those tissues, you have every component you need for the ultimate healing. Now, what about any risks involved? So back up. So what you guys use this placenta matrix, as you call it, and you feel it has the same results as, well, the best results out of all of the ones we just mentioned. But what about safety?
Yeah. Well, let's back up, because you were asking about the adults and why are we better? Why is this issue better? Of course, it has those 4 components. But let's say, because you said most providers are using adult stem cells.
That's what I was saying. Well, do the fat and the bone marrow have those 4 things?
No, they don't.
Okay.
But so most providers use the adult stem cells from the fat on the bone. What are the disadvantages to that? Number 1, if we get those stem cells from the fat or the bone, many times we don't get enough stem cells. Why is that? Because the amount of stem cells in our body drastically reduces with age. So if you're 40, 50, or 60 and we get those stem cells, number 1, do we get enough of them? And number 2, what's the quality? Because they are also 40, 50, 60 years old. So many times we don't get enough stem cells. Then we put those stem cells back in at the site of injury, but we only have to wonder if the biomolecules, the collagen scaffold, and the growth factors are present at the site of injury in order to complete that workforce to get optimal results. And with the placental tissue or umbilical cord, we don't have to worry about it because we provide the whole package to the site of injury.
So using the placenta matrix, what are the percentages of, compared to using your own bone marrow stem cells or the fat stem cells? Percentage-wise, how much better?
To me, it's hard, but I would say 200–300%. What I'm saying is, If you're in shape and you're a young athlete and you get some kind of a meniscus tear and you do the adult stem cells, I think you're still going to get great results. Why? Your stem cells are young, your stem cells are still plenty, and you probably are, if you're a healthy person, healthy lifestyle, all those components may be available at the site of injury. But most of our patients are not that person. Most of our patients are 60, 55, 70, osteoarthritis of the knee. They want to avoid surgery, but they're overweight. There's a reason why they have osteoarthritis of the knee. So, it's very unlikely that within that, patient profile, we have those other components available. So what we have seen with the application of adult stem cells is very inconsistent results. Some people get great results, other people get far less results. But there's other disadvantages. You have to undergo that surgery to harvest them. Therefore, there's an additional risk, there's additional liability, and the cost is much higher too, because we have that extra surgery.
Yeah, so I mean, when I was looking into this, I started looking at safety factors. Are there chances of cancer? Are there chances of autoimmune? Are there chances of contamination? Where are you getting it from? What placentas? Those were all my questions, so I'm sure they have this.
All right, excellent question. So our specific placental tissue is FDA registered and FDA cleared. So obviously the FDA did its job there, but our placentas come from healthy deliveries of C-section babies. Now, the American Tissue Bank has a hand in how that placenta is, taken and then minimally manipulated and goes to the manufacturer and eventually to the end user. It's all, regulated, and the FDA has so too. But only, for example, all those women are screened for all the possible communicable diseases and much more, but only 1% of those placentas is actually used. That's how strict those things are. Now, if we have a placenta, the inner part of the placenta is what we call universal to all humans. So there's no possible allergic reactions, there's no blood typing necessary, and therefore what we have seen with these types of products, that there are no known adverse reactions. Nothing.
That was when I read that, of course, I went outside your website and I started looking, and and it verified what you're saying. Those tissues in the placenta, they're epithelial cells that aren't mom, aren't baby. Is that why they're a safer tissue to use?
Exactly, it's universal. What apparently is, if you have a placenta, it's the outer rind which has the specific information between the mother and the baby. But once that placenta is harvested, it's what they call, according to the FDA, minimally manipulated. And what we believe is happening is, with a gamma camera, they excise that outer 10% of the placenta, which is specific to mother and baby. So we're only left with the 90% of the inside of the placenta, which is universal to all humans, and that's why it's 100% safe and non-immunogenic.
Yeah. So, Meredith, you have a question.
Just a quick question too. So, why is it from C-section births, the placenta, and not from natural births?
Because they are so stringent on every single detail that if it would be going to the regular birth canal, there's a lot more possible contamination by going through the vagina versus the C-section.
Interesting. Yeah. Wow. So, and that's probably an FDA.
It's a regulation.
Yes. Oh, wow. Yeah, that was a great question, because I was actually thinking it, and then I got caught up in another question. She's always thinking. So I have so many questions. I know that people have. You know what I'm saying? So when it's obviously more invasive to go into your own tissues, right? Whether you're fat extracting, bone marrow extracting. What does this process look like? So you're just taking these tissues, you're not harvesting it from me. Obviously, it sounds a little easier, but what does the process look like?
The process is very simple. So we believe, number one, we have a superior product and we don't have to do the surgery, etc. But number two, we also believe we have a superior procedure, because we're not the only ones who can, as providers, buy this tissue, right? But most providers actually blindly inject the tissue in, for example, a knee joint, and then hope for the best results. What we do is we use a MSK ultrasound, which stands for musculoskeletal ultrasound, right? Ultrasound, we all know it, looking at the babies or at your heart valves, etc. But it gives us live 3D imaging of what's going on. So the first step, doctor, is that we basically do a diagnostic ultrasound. People come in for their shoulder. We're going to look at the shoulder in 3D. We can have the patient move the shoulder, see if the tendons move within the, if there's no impingement, and et cetera, et cetera. So it's a much better diagnostic tool than an X-ray or an MRI. So we get that imaging first. Then we generate a report, just like you would get from an MRI or an X-ray. 48 hours, we have a report. Then we'll decide which areas are, need to be injected, the injured areas. And then 2 days later, we can do the treatment, and we use that same imaging to guide the injection
guide the needle
straight to the damaged area. So if this is a rotator cuff tear, we can see on the screen the needle coming in. There's the placental tissue. We even can videotape it, and we deposit that placental tissue right in the damaged area, which allows us for much better and faster results because we are able to accurately place the product where it's needed versus blindly
totally makes sense.
Injecting it in the joint.
So I know my viewers are going to ask this, so you all have seen a lot of different cases here. What does this help? What can it help? I was asking about nerve damage because I have a friend who has, some nerve damage, and, speaking to your guys, we've seen amazing things, So just tell our viewers all the things that, knees, shoulders, go through a list.
That's it. It's anything musculoskeletal, anywhere going from, back pain, sacroiliac joint issues, hip pain, osteoarthritis of the knee, meniscus tears, rotator cuff tendons, elbow tears, muscle sprains, scar tissue, because stem cells also eat away, dead tissue, scar tissue. Anything soft tissue related, inflammation, Achilles tendonitis, you name it, and even osteoarthritis of the knee.
Have you ever had people with severe migraines and you did scans and what are some of the other odd things that you would think that stem cell may not help that actually help?
Well, stem cells can do a lot more than what I'm mentioning in musculoskeletal issues, but in America, we are restricted to what we can and cannot do. So there's many American doctors that take their business outside of the US and actually are very successful, and I know, treating Parkinson's, MS, Alzheimer, and heart disease. It's happening right now. If I had any of those diseases on my family, I would exactly where to send them. But legally, we can't do it in this country. But, to get back on the topic, we had somebody with knee pain, but also drop foot. She had knee surgery, and as we many times can see, with a knee or hip surgery these days, drop foot is a common side effect, right? So knee surgery, drop foot. So we actually also injected placental tissue at the fibular head where the peroneal nerve runs, and we actually got some motion in the big toe and some motion in that ankle wire before that patient didn't have any motion. So yes, we can, feed the nerves with these stem cells as well as muscles, tendons, ligaments, getting great results.
Show them this. Meredith, maybe, I don't know, do you know this particular case? Okay, all right.
I know this case.
Okay, you know this case. Meredith, tell me when I can, how's that? Okay, you can use a pen to point at things, perhaps. Just, go around and just point, grab a pen or do you have a pointer? You can use your finger, I guess.
Yeah, so
and if we have our listeners too, if you can describe what you're pointing at.
Exactly. So what we see here is we see a knee, and these white bones here is the cortical reflection. In other words, that's bone, right? And in between those two bones is a meniscus. That's a medial meniscus.
So you're looking at the before treatment.
Yeah, this is before treatment. So this is the bone, this is the medial meniscus, and here is the medial collateral ligament. Now, in normal circumstances, tissue is just like this white condensed area. So when we look at the meniscus here, do you see these black areas, black, all those little holes? That means it's torn up. Those are all tears. Just like in the medial collateral ligament, all these black areas, these deep black lines, it's all torn up. So this guy is one of my best friends who was playing Frisbee on the beach 2 years ago. And obviously, I guess he was jumping for that Frisbee and torn his MCL and his medial meniscus. So we injected again, needle goes into each and every one of those stairs, and we fill that with the placental tissue matrix. On your post picture, 81 days after the treatment, let's look at that medial meniscus, how perfectly those dark holes have been filled in. Yeah. This looks like a totally new 20-year-old meniscus, right? And then even the bone over here, you can see that it's kind of not even, but even the bone aligned itself and got a lot more better looking. And then if we look at the MCL, here we got all the dark areas and all the tears, and here we see again that it all fills in. Because that's what placental tissue do. It regenerates, it rebuilds damaged tissue. So symptomatically, this patient, after a few days already, could bend his knee again. We went to Colombia. We went for a hike. He thought he wasn't going to make it, especially going downhill. He never experienced any pain. So our patients get great results subjectively, but we also usually 3-4 months after the treatment, we do another diagnostic ultrasound to objectively show on how this placental tissue matrix, when put in the accurate places of damage, in very effectively and consistently can cause those repairs without any surgery.
Cool. Yeah, and that's amazing. One of the things that people probably don't understand is it's not like you're putting the stem cell in there and that's growing into tissue. You're stimulating the body to actually heal. The stem cells that are there, my stem cells that are there, you stimulate that through this matrix to actually start to grow new tissue
and provide all the tools that it needs.
Yeah. So you're growing your own tissue. I mean, it's not like you have foreign tissue. And I know the questions I've gotten. It's like, well, I don't want to grow out someone else's cells in my body. No. It's you. You're growing. That's just stimulating the healing that your body was not able to do.
Correct.
And it starts to heal. So that's really cool.
That's correct.
Yeah, no doubt about it. So Meredith, I know you have some other questions.
Oh, so many. So, well, just what came to mind when we were just looking at those photos, how long are those results typically expected to last? Is that permanent?
Well, it's pretty much permanent, but you got to look at something. Let's say a 50-year-old comes in and his left knee is totally worn out, due to his job, due to repetitive motions, his hips are not aligned, whatever the cause may be. And it took 50 years to get to that stage. Now we inject and rebuild that cartilage. So it's like turning back time, but from the time the patient's done, it starts ticking again because he's gonna play football again, he's gonna walk again. So it's not gonna be lasting forever. But what we're doing is we take something old, we replace it and rebuild it, and now time starts ticking again. So it's very individual, but we're just giving you a new knee, we're just giving you a new meniscus. And then, if you would lay still, yes, it would last forever, but you're going to use it again, right?
That's a great question. What is the recovery time for this?
It's great because even if we think about sports, right, this would be a great application, not only preventatively, because it's always micro traumas. We could extend sports people's career with years if off-season we would inject their throwing elbows or their knees with these things that make sure that the micro trauma are healed before the next season. But to get back to your question, no downtime, really. What we tell people is, okay, you walk out of the office, take it easy for 5 to 7 days. Taking easy means you don't have to lay flat in bed, but if you get your knee done, I don't want you to do jumping jacks or go hiking 6 miles. But you can't go to the shop, you got to do your chores, you can't go to work, and you don't have to stay home from work.
That's amazing.
Just want to take it easy. I had my shoulder done, 6 weeks ago? Because I'm a swimmer, I swim a lot, and of course, swimmer shoulder tendonitis of the, tears in the deltoid, supraspinatus, and subscapularis. I didn't swim for 8 days, and I started swimming again. It feels great. In 4 weeks, I have the National Summer Championships in Minneapolis, so I'm going to see if I can go win there.
Nice. That's awesome.
All thanks to stem cells, otherwise I wouldn't be in competition
right now. Man. Yes.
Downtime, very limited. Take it easy, 5-7 days. No adverse reactions whatsoever.
That's the thing that's amazing, as I really thought there would be more adverse reactions. I thought there'd be more downside or downtime. I mean, all these things, it was a real surprise to me. How long has this been going on? Meaning that the placenta matrix, I mean, how long have we been doing this?
Placental matrix, I guess, from the product that we use, the brand that we use, has been on the market since 2002. So it's been available a long time. But again, it wasn't mainstream. Doctors didn't know anything about those types of things.
I can't believe it's not more known. That's why I'm bringing the show, because you know how much chronic pain is a huge problem. I mean, people are taking painkillers. It's like, instead of understanding this is an option.
No, and if you only knew how many scheduled total knee replacements we have prevented.
The pre's and post, he was showing me all these pre's and posts because I was asking about these different things, and one after another. I mean, and I asked this question. I said, what are the percentages of success? He said 100% pre and post difference in tissue. Now, that doesn't mean that the person's symptoms opposite change, because there could be other factors, right, sometimes. But 100%, they get tissue regeneration, which I thought was unbelievable.
Yeah, we always see some improvement on the imaging, but it doesn't mean the patient is happy with the result. Like, I would say 80–90% of our patients only need one treatment, and they're very happy with the results. They're done. When we have a severe case of osteoarthritis, we already tell the patient, in your case, because there's so much damage and your age and your health condition, you probably need 2 treatments. So then we do a second treatment, usually 4 or 5 months after the first one, and then they get great results too. So we really don't have any unhappy patients, but a small percentage needs that second treatment. But we basically know in advance who that is. It's the ones with the severe osteoarthritis, lots of damage, the ones that, you know, really
they could have, a different biomechanical problem too that's driving a lot of the pain from a different perspective.
Exactly.
If his pain is the gauge. So, all right, Meredith, what other questions you? I think I asked all mine. I don't know, maybe not.
Well, I'm sure more typically come up because this is such an interesting topic, but just a little bit more curious about some other applications too. I was looking on your website prior to the show, and I know there's a lot of cosmetic applications, so I'm very curious about that. And then you also talk about sexual enhancement procedures on your website too. So if you could kind of explain those two and how they apply, I think that'd be very interesting.
She was going to ask that. She always asks that question.
Why not? She's a good one.
All right, I want to hear the answer to this, actually.
No, actually, I own a company where we travel around the country doing non-invasive cosmetic procedures, the regular Botox filler, lasers, you know, chemical peels and stuff like that. So we tried the stem cells on some of our patients for the face, and I have to tell you, I didn't see great results on the cosmetic part. We tried the hair restoration, we didn't get the results we really wanted. But on the ED, erectile dysfunction, or the male enhancement, we see great results too. We know that a lot of offices in the metropolitan areas are using PRP for those same things, platelet-rich plasma, which is a procedure out there that has great results with it. Again, but PRP, what is PRP? We have growth factors, right?
That's what it is. Right?
Okay, but we have more than
that was one of my questions.
Yes. So that's the difference between PRP and stem cells, because people say, why would I do stem cells? PRP is cheaper. They draw your own blood. They spin it, so you have your platelets, and your platelets are what? Growth factors, right? So the growth factors then stimulate the stem cells that are already in the body, which is great. It's 2 of the 4 components. It may work great, it may not, but we would, with our placental tissue matrix, have the stem cells and the biomolecules also, right? But so for ED and enlargement and those types of things, we get great results. I wouldn't try to sell you with our product a hair restoration treatment or a cosmetic treatment.
Yeah, that's very honest. Yeah, that's great.
Well, so why do you think you don't get as great results with the cosmetic treatments with the stem cells?
I don't know. There's not really any set procedure or protocol. We have a product. We assume that, you know, with the growth factors and things, this should work. We just, with the few patients that we didn't get the results that, I mean, the patients were kind of happy. I even didn't see much significant improvements. At that point, you know, I don't want to market it because we get such great results with what we're doing, the musculoskeletal injuries. So I don't want to market something that has lesser results, and then people say, it didn't really work, right? So maybe it's the application, it's the procedure that needs to be tweaked. Maybe it's where do you put it? Do you put it in the epidermis, the dermis? Do you put it in the subcutaneous layer? I mean, there's so many ways we could alter the application of it, but we're not there yet. That's correct.
So how do you evaluate someone and how they would possibly need stem cells? So if someone comes into your office and say perhaps they're looking for a stem cell therapy for a knee injury, but do you kind of look at their whole body and assess it, and perhaps they need it in other areas, or perhaps they don't need it in that area but they need it somewhere else? Like, how do you do that assessment?
Yeah, the first thing we like to do is we like to get people educated. So we send them to our website to request our free report. It's like 33 pages, but it explains exactly what we went through on the video today. You know, on the different sources, etc. Once they're educated, we answer the questions they may have. Then if they say, yes, I'm interested, my shoulder's hurting, then we have them coming for the diagnostic musculoskeletal ultrasound. We gather all the other information. They have the MyF X-rays results already, or MRI results. We get obviously a medical intake. We gather that information, but then still we want to do our own diagnostic ultrasound just because it's 3D, it's live. It's right there and then, and we need to take those images anyways because we're going to use those for the treatment to guide, you know, the needle to the damaged areas.
No.
And then 48 hours later, we have the results. We know where the damage is, and then we can decide the more damage, the more product we would need. So then we know how much product we need, and then we can tell the patients what the cost would be, and then we schedule them for the treatment.
Yeah, what are some of the costs? I mean, people are going to ask this. I know the answers, but does insurance cover it?
Yeah, insurance doesn't cover it. I mean, we're in America. Anything that works.
I knew the answer.
Anything that works.
Insurance.
Anything that works.
And then give them a price range.
Yes.
You know, just.
So it used to be very expensive because of the surgery, the harvesting. So if even now, if you would go to, I mean, Florida, Orlando, Tampa, and you go to some of those providers that do the bone marrow or the fat tissue, you're looking at $7,000, $8,000 up to $20,000. That's a lot of money. But because we don't have to do the surgery and the harvesting, our prices are much less. So for a soft tissue injuries like rotator cuff tendons, like I did, you know, my treatment would have costed $3,400. If you have a severe issues with a knee, but there's like your patellar tendon needs injections, your meniscus needs injections, there's your ligaments are, you know, ruptured, and you know, it could run up to like $5,000. So I would say between $25,000 and $5,000.
Yeah. You know what? That's a deductible on their darn surgery today, right? I mean, people have to understand that. You know, and then how do they contact you? Because people will fly in for these treatments. Tell them how to contact you, what their first step is.
Well, the first step is go to our website. It's www.NeoMatrix Medical. That's N-E-O, NeoMatrix, M-A-T-R-I-X, medical.com. And you'll see easily on the homepage, request your free report. There's an 800 number. I suggest read the report, write your questions down, then contact us. We can answer the questions, and then the next step would be, okay, let's see if you qualify now. And then they come over and we do the diagnostic ultrasound. When people do fly in, when they're not local, we try to schedule it, the diagnostic ultrasound on day 1, the treatment on day 3, so they can get it all done and fly back home that way.
Awesome. Yeah, that's simple. It is remarkable. I mean, honestly, people considering surgeries that are on pain meds, I mean, man, to me, it's a no-brainer. Meredith, back to you.
Love it. Well, yeah, and thank you. And in closing, Dr. Mike, if you could share with our viewers kind of 3 key points that you would say or just kind of take-home reminders for us in understanding stem cell therapy, and what would you most like our viewers to understand? Three top points.
Yeah, why they should get it, why they should get this type, and, you know, I mean, something. You know.
Why you should get it, because we are still so ingrained listening to our conventional doctor, and we only think that the options are drugs and surgery. And we need to just broaden up our mind and look at the other options, and they are available today. Stem cells is not a thing of the future. Scientists agree it's the medicine of the future, but it's available today, so you need to look into it. And then once you look into it, you know, of course, there's different types and different sources that we discussed, so make sure you do your due diligence, ask your questions, and go to the right provider, which obviously is us. But
I wouldn't be here otherwise.
But at least consider that option. That's number 1. Number 2, we talked about price, because obviously it's a big objection. If I have a knee replacement done, they say my insurance pays, but they don't consider many things. There's probably a copay with the insurance. Then you have to have weeks and weeks and weeks of physical therapies where you have copays. You probably can't go to work for a long time. You probably have to buy a brace or and you have medicines and you have copays, and guess what? It adds up to $3,000, $4,000, which would have been the cost of this procedure. No downtime, no side effects. So especially when you not just want to get rid of your pain, but you want to take your life back and function again, or do the things you like to do, your hobbies, your sports, this is the way to go. It's a quick fix. Yeah. No,
I would add this. It's real healing. You know, it's like you can do a lot of those things you mentioned, but you still don't have tissue there. You know, whether it's a knee, a shoulder, you still don't have tissue there. So it may last a year, whatever you did, but it's not going to last because you still need tissue. This is tissue regeneration.
It's a good point he brings up, because the placental tissue has a strong anti-inflammatory properties. So once we do the treatment, in many cases, the pain drastically reduces in a few days, which is like great for the patient, but it also addresses the cause. And conventional medicine never addresses the cause. So the stem cells rebuild the tissue. If you have a knee arthroscopy, you shave away the tissue, which is the opposite of rebuilding the tissue. So we treat the symptoms and the cause, and that's exactly what you're alluding to.
Yeah. All right, Meredith, that's a good reason.
Awesome. Love it. Well, thanks for reporting live, Dr. Pompa. I know you're there for a reason, so I'm excited to hear more about your personal experiences with stem cell therapy. You'll have to share with us on a future show. And thank you so much, Dr. Mike, for sharing your knowledge on stem cell therapy. I feel like I've learned so much. So thanks for joining us and sharing on Cell TV. And you guys have a wonderful time in Florida. And thanks again for joining. And thanks for watching, everybody. And we'll talk to you next time. Bye-bye.
Okay.